Welcome to the concept of teaching and learning. Our exemplars are hospitalized individual teaching, learning process. Our outcomes are define teaching and learning concepts, define the role of the nurse in the teaching and learning process, explain the three domains of learning, which is psychomotor, cognitive, and affective domains, identify basic learning principles for individuals across the lifespan, explain the more importance of the learner participation in teaching and learning, and identify principles of effective teaching, describe potential barriers for the learning process, and identify strategies that can be used to evaluate the teaching and learning process. Intro to teaching and learning. Teaching and learning is a dynamic interaction between teacher and the learner. Teaching is a system of activities designed to produce learning. Learning process involves dynamic interaction between teacher and learner. Each communicates important information and perceptions, attitudes towards the other. Learning is a change in human disposition or capability that persists and cannot be accounted for solely by growth, represented by change in behavior. So just think about that for a minute. A behavior is learned, so it's learned. So that means that at some point it was taught to be learned. Do you see what I mean? So nurses and as teachers and nurses as learners. Nurses as teachers, we teach patients and their families. Most of this is done directly with patients. So we teach the patient how to care for themselves, but a lot of times families need to get involved, especially if there's caregivers of clients or patients that have difficulty with self-care, children or other older adults especially. We also teach colleagues and other healthcare personnel. Learners must complete formal education before entering the profession. So first off, even to be a nurse, we have to complete that formal training, which you guys are all going through now. We have to continue to learn current practices. So that's our evidence-based practice. Those are our things. It's going to be a continuation. We have to learn. We have to stay up to ANA standards and complete our continuing education requirements by our State Board of Nursing. A lot of employers may provide this education for you guys, so you can keep current and up to date. Anyone that wants to specialize, sometimes nurses need to specialize, and that is a continuation of learning and also advanced degrees. The teaching process. The teaching process is a lot like the nursing process. We need to assess our learners. We need to create a goal for these learners and have their input, use their input, like, hey, can I achieve this? I think this is a good goal we need to achieve, and work together to create that goal. We create a learning environment for them, so we don't want a noisy or crowded space. Usually we kind of want it to be an open space or a place that the patient feels comfortable, that's less stressful, so that we can learn and that fosters that learning. And then we have to present this evidence and present solutions to them, so a plan for learning for them and build a rapport. And then on top of this, we have to evaluate whether or not it's working. So big piece of this, like, we have to be able to hold the learner's interests, involve the learner in the learning process, creating a partnership. We have to foster positive self-care in the learner. This is appropriate for, we have to make sure that the education is appropriate for the learner's age and condition and abilities. We have to set realistic goals. So I'm going to stop quitting. I'm going to quit smoking tomorrow. Might not be a reasonable goal for this person without a nicotine patch. Do you see what I mean? So you might want to educate them that, hey, we have these things available for you. Why don't we use these resources? And that then a realistic goal would be in a couple weeks. Supporters, we have to support learners, optimism, positive reinforcement and feedback. Use accurate, current, evidence-based information from reliable sources. We'll talk about that in a little bit. Reliable sources. We're not Dr. Google. Uses several methods of teaching, uses methods for evaluation of learning, and is cost effective. Patients and families are not going to come unless it's cost effective. Aspects of learning. Learning is a need, learning need is a desire or requirement to know something currently unknown to the learner. So we don't know what we don't know, right? So there's a need. Compliance, the individual's desire to learn and act on the learning. So that's the action. Compliance is, yeah, I know how to take care of my diabetes, but I'm not doing anything about it. So there's a compliance issue. Do you see what I mean? In healthcare context, extends to which person's behavior coincides with the medical advice. So like, oh, they're not taking that, there's non-compliance. We throw out non-compliance a lot, but you need to be careful of how you're using that word. Individual accepts the need to learn and follows through with their actions reflecting learning. Important to not quickly label a patient as non-compliant. We must determine that a patient is not following the recommendations and is in fact not doing these things that they're learning. Adherence, attachment to a prescribed regimen. So are they adhering to this regimen? More positive connotation than compliance. So adherence sounds a lot better than compliance. Emphasizes collaborative nature with the provider and recognizes the factor that the patient's willingness to comply. So we're going to quickly touch on these learning theories. You have to know about these learning theories in order to teach someone. So an adult learning theory is that adult learners are definitely different from children. They need to know why they should learn something or they don't want to. They prefer others to treat them as a capable and self-directed person versus to just tell me what to do. They've accumulated experiences that can enhance their learning and are often ready to learn what they must in order to take care of themselves. And then we have to keep time and perspective as well. Implications for teaching: communicate how and why the information is important and useful, and identify previous experiences that can help the learner incorporate this new information. Next is the behaviorist theory. This theory takes the individual's response to stimulus is either a positive or negative, and then it's reinforced. So a change of behavior is altering the stimulus to change the response and then altering what happens after the response. So use of positive reinforcement, praise, encouragement to foster the desired reaction. Like, yes, that's right, you can do it, that's right, that's right. Implications for teaching: provide praise and encouragement which they each attempt or each phase of the learning process, you keep giving that positive reinforcement. Allow enough time for the learner to practice the new skills, and then consider environmental influences that might affect that learning process. The cognitive theory. So these are your three domains. Three mental processes that can occur sequentially or simultaneously. They're acquiring information, processing that information, and then using that information. So learning occurs across the three domains: the cognitive, which is the thinking; the affective, which is the feeling; and the psychomotor, which is the actual skill. So implications for teaching: develop the strategies appropriate for each learner's style and preferences. This is where your learning stuff comes in. Like, are you a lot of people say that, you know, I don't have that feeling, I don't have that affective nature. I'm more of a psychomotor person. I like to learn by touching. Some people like to learn by thinking, by reading, those types of things too. So there's definitely different things that you can do with these learning theories. Got to assess the learner's developmental stage and emotional readiness to learn. So for example, remember I told you when we're stressed out, we become our teenage selves again, right? So that's kind of where these patients are. If they are not ready to learn, they're not going to learn. So you have to kind of look at their emotional readiness. If they're still anxious or upset about something, now's not the time. We have to adapt our strategies to these learners' levels and select objects encompassing all three of these domains. So using thinking, feeling, and a skill is usually helpful in a student or a patient's learning. The constructivist theory. So learning is a developmental process constructed from an individual's experiences. So it just keeps building from those other experiences. Knowledge acquired by ongoing assimilation, accommodation of new experiences, and interpretations. So it just keeps building like a mountain. Cooperative learning and problem solving promote learning. So that's part of this theory. Implications for teaching is acknowledge the importance of the learner's prior experiences and build on them. Encourage the learner to engage with the nurse and the others during this learning process, or otherwise that they won't get that base. The social learning theory. Learning results primarily from instruction and observational learning. Learning process focuses on imitation and modeling. This is also like a cognitive aspect would be a person's beliefs, perceptions, cognitive competencies, and influence how the person interacts with their environment. Implications for teaching. Nurses provide an opportunity for imitation and modeling, and by modeling how to perform skills and asking them to repeat it in demonstrations by the patient until the performance is satisfactory. So theories that change the idea that intelligence is static based on the learner's IQ. Theory of multiple intelligences. It bases on observations of the way which like stroke damage can affect one area of the brain while leaving others intact. Gardner intelligence has 8 dimensions: linguistic, musical and rhythmic, spatial, body kinesthetic and movement, personal, and symbols as intellectual strengths, and naturalists. This was added to the original 7, the naturalists, and associated with recognition of the environmental elements and patterns. So more of these are the emotional intelligence, like they measure the individual's ability to differentiate between their own thoughts and feelings, recognize thoughts and feelings of others, and show discernment when using emotions to influence decisions. As irrelevant to learning and success as an IQ, it has more than just like an IQ for this It's helpful with stroke patients especially. Nurses must understand that the focus and the limitations of these various theories. Intelligence levels are unique and specific to every person. Individuals can be on a higher operant level of some intelligences than others, and nurses can select the more appropriate theories when developing a teaching plan for a specific patient. I've used all of these. I think I've used all of these and I mix these up. It's really nice to understand though where your basis of your theory is coming from. For like example, for you guys, I usually use more of a adult learning theory, but sometimes I need to use a modeling theory like in lab. Other times I might use an intelligence theory for specifics. Do you see what I mean? So there's a lot of things that you can do with these theories, but you just need to know how they're useful to you in building your plans. Factors that affect learning. Everything affects learning. Factors that facilitate learning are motivation to learn, your readiness. So if you're motivated and you're ready to do it, then you're probably going to do it, right? Active involvement in the learning process. If you are active in again, doing is doing. Relevance of the information that's being learned. We don't want to learn stuff that we don't need to know. Am I really doing this? Why am I doing this, right? Feedback about the person's performance and relation to the desired goal. So that's kind of like tests, right? We need to know where we're at. Am I learning this stuff, right? Non-judgmental support. Guys, we got this. This is a learning process. Do you see what I mean? Information that proceeds from simple to complex. So I actually like the theory novice to expert for nursing, because that's exactly what it is. It's a growth. You're going to be a novice for a while and you're going to grow to be an expert. Repetition of key concepts and facts. We got to keep repeating it. We got to keep going back to basic, right? Back to basic. Timing. People learn best when there's a short interval between learning and using what they have learned, which is why an ADN program is so nice. Do you see what I mean? Because you guys are learning and then you're doing. You're learning and then you're doing. We have class, then we have lab. We have class, then we have lab, then we have clinical. Do you see how that works? So that you can integrate those skills and you can integrate all of those things. The longer the time between the interval, the easier it is to forget the skills. I mean, that summer break, I think, killed us. But, you know, those are the things that we have to battle. We have to get you guys back up to speed. And we have to, you know, you ever hear of the saying, if you don't move it, you lose it. You know, if you don't do it, you know what I mean? You're gonna lose that skill. Barriers to learning, emotions, fear, anger, depression, anxiety, life circumstances, guys. I mean, it affects our learning. We can't learn when we're stressed out. Psychological events, illness, pain, sensory deficits, cultural aspects, different languages. It's so much harder to learn in a different language. You don't know what's going on. Okay, and even if you do know what's going on and your brain still has to process in a different language, sometimes that's difficult. Values from the healthcare team, so you might not understand the beliefs or value system. Psychomotor ability, so just pure strength. Being on the floor for 12 hours, it's hard. Motor coordination, energy, your sensory, I mean, if you're not getting enough sleep, I mean, you're not going to have enough energy to learn. We have some lifespan considerations. Children, oh my God, guys, children. Nurses must first assess the child's developmental level, and especially when they're upset, you know, they go backwards. Teaching plans focus on primary health care. Teaching plans should usually be directed towards the primary caregiver. So in this instance, you want to teach the parents how to help their children. Basic instructions, you can give them basic instructions. Okay, you know, you have to put this Band-Aid on every day, and they can usually learn that, and they can give you feedback, and you can give praise and encouragement to them, reinforce the teaching as needed. And please note, you'll see on all of these, it says document learning intervention. You've got to document your learning intervention or it's not done. So adolescents, woo! So nurses, again, must assess the developmental level and independence from the parents' caregivers. Okay, so you might want to actually teach the patient on this one, unless they say, hey, you know, my mom's really better at this or my dad's really better at this. Can you teach them too? And you make that part of their decision. Teaching and health promotion should focus on safety, consequences, and personal responsibility. And due to the environmental influences and peer pressure and risk-taking behavior, we've really got to rein in our adolescents. Allow time for questions and practice. Provide feedback and praise and encouragement. And evaluate if it's working. Also reinforce when needed. Adults. Nurses must seek, again, to determine their unique preferences. Even when you've worked with that patient in the past, things change. It's essential to gather subjective, objective data and objective data about your patient, personal demands, responsibilities, education level, cultural influences, motivation to learn. The nurse's awareness of their own learning style might help in developing the teaching plan for this patient. It's important to allow time for questions. Same thing as your adolescents and your children. Provide feedback, reassurance, and support. Emphasize and promote importance of positive health practices. Actively involve the patient in your care and in their care. And remember that nurses cannot control the patient's responses to their change in their habits. Older adults, teaching focuses on health promotion, disease management, illness and injury prevention, teaching with regard to medications and therapies for chronic illnesses. That's usually our main topics for older adults. Teaching plans center on nutrition, physical activity, physical safety, medication, and the need for follow-up for healthcare appointments. They address aging factors that influence comprehension and develop teaching plans to ensure that the maximum learning is occurring. A couple other things about older adults: the ability to learn might be affected by their sensory alterations and energy levels, physical abilities, cultural influences, memories, memory response time, and stress. You must include the patient in the teaching and learning plan and keep those setting goals. Allow for adequate time for processing. It might be a little bit longer. Include significant others if the patient allows. Calm approach in a peaceful environment. Allow time for questions. Same other things. Patients with special needs. Patients with physical, cognitive, and/or developmental impairments might need a little bit more help than others. Patients facing social and environmental issues that affect their health and well-being may also need some extra resources. Before any teaching or intervention, please perform a complete assessment, home environment, support system, and the developmental level. During teaching, you might need to stress the importance of the interprofessional interventions. So it might not just be the primary care physician that they need to see. They really do need to go see endocrine. I know this says 1 of 3, but technology, health information, and patient teaching, I really just want to touch on this. Internet has changed how providers, patients obtain their health information. E-health movement, okay, everything's online now. Okay, as I mentioned before, Dr. Google, there's definitely some unreliable and questionable sources. We want to drive our patients to the right sources, and we want to look at the right sources. So driving our patients to .org or the big ones, we want to give them good resources to look at. So like, hey, if you do have a problem, if you are going to Google something, please look at this site instead. Thank you for listening. Have a great day.